So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about reading the containment plan. The sealing of COVID-19 hotspots is part of the government's larger plan to contain the spread. A look at the approach laid down stage by stage and what is recommended on hospitalization and treatment. In the last couple of days, several areas in the National Capital Region have been cordoned off and sealed to try and restrict the novel coronavirus disease COVID-19 within that area. This is part of the India's containment plan, and essentially an updated version of an earlier health ministry blueprint that was drawn up when the only COVID-19 cases were those coming from abroad. What are the components of the plan? The plan outlines a strategic approach based on the stage of the transmission. 5 stages have been identified: travel-related case reported in India, local transmission, large outbreaks, amenable to containment, widespread community transmission, India becoming endemic for COVID-19. At the time of writing this document, many of the crucial epidemiological information, particularly source of the infection, mode of transmission, period of infectivity, etc., are still under investigation. Reads a disclaimer. Officials say it means that the plan is subject to revisions if required as and when there is greater clarity about some of these aspects. What is the approach recommended for the various stages? Containment of the local transmission hinges on extensive contact tracing and search for the cases in the containment zone, testing all suspect cases and high-risk contacts, and isolating all suspect or confirmed cases, quarantining contacts or social distancing for larger outbreaks. In addition to the usual measures, there is higher focus on a particular geographic zone, and hospitals around the area are prepared for a rise in the cases. This was done in an early March when the area was cordoned off. Contact tracing and isolation undertaken at a large scale in the Lerma area. Alasan Hospital became the base of the surveillance team and also the place where suspect cases could be taken if required. In addition, all symptomatic healthcare workers are to be given hydroxychloroquine as a preventive. The graded containment plan in effect takes lessons from the H1N1 influenza pandemic, where the spread was in clusters. The current geographic distribution of the COVID-19 mimics the distribution of the H1N1 pandemic influenza. This suggests that while the spread of the COVID-19 in our population could be high, it's unlikely that it will be uniformly affected all parts of the country. This calls for the differential approach to the different regions of the country while mounting a strong containment effort in hotspots, reads the plan document. However, confirmed and suspected cases to be dealt with. It says that all suspect confirmed COVID-19 cases will be hospitalized and kept in isolation in dedicated COVID-19 hospitals, hospital blocks. Persons testing positive for the COVID-19 will remain hospitalized till such time as 2 of their samples are tested negative. As per their discharge policy, about 15% of the patients are likely to require hospitalization, and an additional 5% will require ventilator management. To reduce the burden on the hospital, there is a plan to temporarily convert hotels, guest houses, stadium near COVID-19 hospitals as care centers where mild cases may be kept. Dedicated COVID-19 hospitals, dedicated blocks in large hospitals will be identified or personalized. Moderate to severe cases who require monitoring of their clinical status. Patients with radiological evidence of pneumonia will be admitted to the COVID hospital. For more severe cases requiring respiratory or other support, tertiary care centers, both private and government, will be including as part of the micro plan. So the protocol was based on the severity. Yes, the health ministry has issued directions for categorization of the designated facility into 3 groups: COVID care centers, COVID health care centers, and dedicated COVID hospitals. The care center will be for cases clinically assigned as mild or very mild or suspected cases. The health centers are hospitals that will offer care for all the cases that have been clinically assigned as moderate. The dedicated hospitals will offer comprehensive care primarily for those clinically assigned as severe. The COVID care centers are makeshift facilities. These may be set up in hostels, schools, stadiums, lodges. Both public and private COVID health centers should either be a full hospital or a separate block in a hospital with preferably separate entry-exit zoning. They will have a separated areas for the suspect and confirmed cases. Suspect and the confirmed cases should not be allowed to mix under any circumstances, said the document on the categorization of the care and hospitalization facilities prepared by the Emergency Medical Response Division of the Health Ministry. What is the line of the treatment? The document collects the various advisories issued by the Indian Council of the Medical Research, emphasizing that till now there is no approved specific drug or vaccine against COVID-19. However, hydroxychloroquine has been recommended as a chemoprophylaxis drug for use as a symptomatic healthcare workers managing COVID-19 cases and asymptomatic contacts of confirmed COVID-19 cases. In addition, a combination of the hydroxychloroquine and azithromycin has been advocated for use in the severe cases of the COVID-19 under medical supervision. It says on Thursday the ICMR said in the final stages of the preparing a clinical trial protocol for the convalescent plasma therapy. Thus, it addressed concerns of the healthcare personnel amid unrest among the medical personnel across the country of the availability and the quality of the personal protective equipment. The plan would address the need for the adequate at all times of the doctor, nurses, and paramedics working in the clinical areas will wear 3-layer surgical mask gloves. The medical personnel working in isolations and critical care facilities where aerosolization is anticipated with full complement of the PPE, including the N95 mask. The support of the staff engaged in cleaning and disinfection will also wear full complement of the PPE. Environmental cleaning should be done twice daily and consist of damp dusting and floor mopping with Lysol or other phenolic disinfectants, or cleaning of commonly touched surfaces with sodium hypochlorite solution, says the document. Sodium hypochlorite is already being used extensively, including in the Nizamuddin headquarters of the Tablighi Jamaat. So if you like the channel, so kindly subscribe to it.